9% revenue growth against 2020, driven by a resumption of elective procedures in hospitals, a strong diagnosis and treatment business performance, consumers really liking our innovations, and still in connected care, the emergency response equipment such as ventilators and monitors going well. As the year will progress, however, of course, the comparison to last year is actually becoming a bit more difficult, right? And this is playing into your question, why not more? So at this time, we are looking ahead at a strong second quarter, but then the second half year comparison is more difficult versus last year. All in all, we are raising guidance from low single-digit growth to low to mid-single-digit growth, which is still a significant step up in a world where there's still plenty of risks, I would emphasize.
It's a fair point. Better to under-promise and over-deliver. I get that, Frans. But look, if we'd have spoken to you at any stage in the last few years, you would have been very consistent in your mantra. You want to be a health tech company, connected care and the rest as well. And to be fair, given everything we've seen over the last year and a half, that has seen a very strong strategy. You had no idea about COVID-19, but obviously more connected care at home, more health tech. That has been your very firm mantra as well. But is there anything that's happened in this COVID epidemic that has made you think, actually, we need to focus more on this area or another area over here?
Definitely. We have validated our strategy together with the healthcare providers, and we have seen a confirmation that the strategy is right. We will see an acceleration towards telehealth and the adoption of healthcare informatics, both of which we have been heavily investing in over the last few years. We will also see a shift of care from the hospital to the home, where doctors and patients can also connect in different ways, and COVID has been a catalyst to that trend. In the first quarter, which besides strong was also busy, we were able to integrate 2 acquisitions that further strengthen our leadership. Biotelemetry is a leader in cardiac monitoring at home, and also Capsule helps us to integrate the data from patient devices and provide meaningful insights to doctors remotely. And so you can see how we are further building the health technology portfolio to really deliver on what is the digital future of healthcare.
Frans, just to pick up on some of your caution around the outlook, obviously supply chain shortages have been a feature of the pandemic, and we've had semiconductor shortages. Can I ask you, how close to normality is the business now with regard to both of these challenges, or do you see some long tail effect through the rest of 2021, and how much are you being impacted?
Well, we just talked about the fact that we see an uptick in revenue, and I'm sure that we are not the only company who is seeing a strong traction in an economy that is robust. This all leads to more demand for semiconductors, and we are already seeing some issues in dealing with that. And one of our businesses in automatic defibrillators, for example, we had some shortage. So we're working very hard to work with the semiconductor makers to at least safeguard medical equipment, which we would all agree is essential for the population. For the latter part of this year, I think there's still some unknowns on how the semiconductor market will be able to cope. So this is something where I'm very much on top of.